It is estimated that 12 to 15% of the adults over age 60 suffer from hip pain. Today, we're looking at some of the treatment options, and with us is North Shore neurologist and pain treatment expert, Dr. Chad Domingue. Thank you so much for joining us.
Good afternoon. And when you have hip problems, these hips do not lie. And we'll talk about how to keep them quiet.
Yeah, it can be really painful. Let's start with some of the causes of hip pain.
Yeah, so just to start with anatomy, because it's always good for viewers to understand the structures that we're talking about. This is the femur, the top part of your leg that comes into the hip, which is a ball and socket. So this is the femoral neck, the femoral head, and this container is called the acetabulum. There are several ligaments and other soft tissue structures that keep this in place. One of the most common ones people know is called the labrum. The labrum is kind of this outer rim, soft tissue, fibrous tissue that keeps the ball in place. So when we talk about hip problems, osteoarthritis, traumatic injuries, avascular necrosis, so losing blood supply. But just to put it simple, is wear and tear, right? People that wear out their hips just over time, the joint destroys itself.
Okay, so if you don't want a hip replacement procedure, because that's scary for some, they don't want a hip replacement. There's something new that it's experimental. I don't know how often it's used here or where it's being used. I know it's being used on knees a lot, but it's called, you can correct me on this, autologous
Sorry.
matrix induced chondroplasty. What can you tell us about this newer procedure that involves replacing the damaged cartilage?
So I talked to some of my colleagues through Vala Hospital here in Covington, Dr. Chandler and Dr. Schumacher. To their knowledge, no one's done this in Louisiana. It's done more often in knees because knees have more problems with cartilage deficits. The hip is such a large joint that usually when it wears out, the whole thing wears out. But what the surgery does is pretty neat. They'll go in and they'll biopsy a part of the normal cartilage, which is a chondrocyte. That's the name of the cell that forms cartilage. And there's two different types of surgeries. One, they'll take a collagen membrane and grow that membrane for a month. So they take your cells and they grow it, and then later they'll go and re-implant it to line the cartilage like it was normal. The other one is they'll just put that membrane in the joint and they'll drill a hole into the bone marrow and let that chondrocyte form inside. They pretty much accomplish the same thing, but one surgery is two surgeries and the other one is one. But again, this is very new in the hip. It's done a lot in the knees. So the data is really still out as to how effective this is long term.
And if this is something someone would be interested in, are there other parts of the U.S. where possibly they can get it done?
Yeah, so I talked to Dr. Schumacher here in the North Shore. He's actually looking for someone to do this on. It's a very niche procedure because you got to catch these people early. Because if the cartilage wears out, they develop bone spurs, the joint wears out, and that surgery is no longer useful. So you have to see someone very early on with hip pain that just has lost the cartilage, but the joint itself is still structurally intact.
So you would have to obviously like get an X-ray to determine how far along it is for something like that new procedure instead of a hip replacement to be done.
Absolutely. And we talk about this all the time, Liz. If you're having hip problems, any problems, get to your doctor because the sooner you can identify a problem, the better. Because other than this surgery, you mentioned hip replacement, you're talking about arthroscopic surgeries, debridement, steroid shots. I mean, the other stuff is just not as good as we would like. And so I really like the concept of regrowing cartilage and restoring that normal anatomy.
Okay, and lastly, what are some of the other things that you would recommend for people dealing with pain, the treatments they may not know about?
Yeah, so you mentioned a couple. Obviously, you always want to start simple. Debridement, washing out. One surgery we hear a lot of is what they call a microfracture. So what they do is they'll drill into the bone, and they'll drill inside into the bone marrow. And by drilling into the bone marrow, the young stem cells will come out and replace that cartilage with like a fibrous material. It's not as good as the transplant you and I are discussing, but it certainly gives a little bit of normal anatomy. And then obviously the last option is the hip replacement, which we all want to avoid.
And why is it people want to avoid that?
Well, I mean, again, we're men, we're not gods, right? And anything that is not a normal anatomy is never going to be as good as what God gave us. And when you're talking about implantable hardware, it's a big surgery. These things wear out. You don't want to implant an artificial hip too young because then you got to get another one in 5 or 10 years, and you don't have the activity or the structure that you do with a normal hip. It's a good surgery. We send people for this all the time, but you definitely want to exhaust all options before getting an implantable hardware in any part of your body.
Okay, Dr. Chad, thanks as always, bringing us up to date hip replacement surgery and the pain that so many people deal with daily. And always, people can reach out to you at on the North Shore as well, right? For more info.
Yeah. Yeah, so you social media, Dr. Chad, Facebook, Instagram. My number is 985-892-8934. Yes, always happy to help any of our viewers who have any questions.
Anything to overcome the pain so many people deal with daily. Thank you so much. Have a great day.